Hello, good evening everybody, and welcome to this special online event. This webinar is the second in a series of online discussions we call Listen, Share, Learn. And these sessions are organised by the Centre for Research Excellence in Newborn Medicine, based at the Murdoch Children's Research Institute. The aim of these online sessions are to get health professionals, service providers and parents together to discuss important topics in the field of newborn medicine. Tonight, we're going to be discussing the educational issues for children born preterm, and we've titled it Navigating the Education System for Preterm Children. My name is Peter Anderson, and I'm Professor of Paediatric Neuropsychology at Monash University, and one of the many Chief Investigators in the Centre for Research Excellence in Newborn Medicine. On behalf of the CRE and my colleagues, I would like to acknowledge the traditional custodians of the country throughout Australia and their connections to land, sea and community. We pay our respect to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Island people tonight. Okay, tonight will be largely a Q&A session, a question and answer session with our expert panel of health professionals, service providers and parents. Before the panel session, we are going to provide some general information about what research tells us about the schooling experience for children born prematurely. We're also going to hear from two parents who have the courage to share some of their experience with educating their child who was born preterm. We've already received some questions from people. They did this when they were registering for this event, and we'll address as many of these tonight as we can. Now, we want this to be a really interactive session, so we strongly encourage you to submit additional questions. And to do this, you're going to need to type your question in the Q&A box, which you should be able to find at the bottom of the Zoom window. Now, you've probably noticed that you're muted and your videos are turned off, so the only way you can share your thoughts and questions is to use the Q&A box. And we're really keen to hear from you, and we'll try and get through as many of these questions as we can in the time available. Please be aware that the session is being recorded and will be available for others to view in the following days. So keep that in mind when you're sharing information. Now, we hope this session will be really helpful for you, families and service providers. However, it is possible that our discussions will trigger issues and thoughts for some. If this is the case, we encourage you to seek support, and at the end of the session, we will provide a slide like this with resources which you could use if needed. So I'm going to stop sharing my screen now, and if I can ask the panel members to turn on their videos. And I would like to introduce to you the expert panel we've got today, and also the parents. I'll start with the expert panel. We've got Nicole Knight joining us. Nicole's a speech pathologist and a regional disability coordinator in the Department of Education. As part of her role, Nicole provides advice, support and guidance to schools and families in the areas of funding application, and also supports practices in schools. So she's going to be really helpful for us today when we're talking about the support that's available within schools. We've got Cinzia DeLuca. Cinzia is a clinical neuropsychologist who specialises with children. She worked for 8 years in a follow-up program for preterm children, so she's got a great awareness of the learning and educational problems that can be faced by some children born preterm. We've got Gihan Roberts. Hi, Gihan. Gihan is a paediatrician based at the Royal Children's Hospital. He did his PhD in children born preterm, specifically looking at school readiness. In addition to knowing a lot about preterm children, has a lot of knowledge and experience with educational and behavioural problems for children. And we've got Kate Jacobs. Hi, Kate. Kate's an educational and developmental psychologist. She runs a large private clinic supporting children who have problems at school, with a particular focus on assessing difficulties that children may have, strengths and weaknesses, which that knowledge can help with designing programs for kids to support them. And we're very fortunate to have Julia. Hi, Julia. And Liam. Hi, Liam. And they're two parents who are going to be sharing their story with us today. So to start this webinar, I'm just going to give you a brief overview of what is known about academic outcomes for children born preterm from a research perspective. You'll see that most of my slides focus on children born very preterm or extremely preterm, and that's children born at least 2 months early. I'm focusing on these children because in Victoria we have really good data on these children, but also because they're the highest children for learning and educational problems. This slide shows the average scores for children born extremely preterm in red and children born full term in blue on tests of reading, spelling, and maths. The higher the bar, the higher the score, the better the performance. And you can see immediately that the blue bars are always higher than the red bars, meaning that the children in this group of full term children are scoring higher than children born extremely preterm. And on tests of reading and spelling, as you can see here, that's on this particular test is 6 to 8 points. And on this test, that's a pretty marked difference. For those of you who are statistically minded, that's about half a standard deviation. On tests of maths, we see a difference of about 10 points. And so that's about 2/3 of a standard deviation. And so you can see that the difficulties for children born preterm are more marked in maths. Now, this is data from Victoria, but it's pretty consistent with what we see in studies from other parts of the world. Now, group means don't tell you how many children are having trouble and can often be misleading. So on this slide, based on the same children, I'm presenting the frequency or percentages of children with no problems, mild problems, or major problems in the area of reading, spelling, or maths. Now, for each of these different educational domains, we've got the full-term group, a group of children, and a group of children born extremely preterm. And these darker bars represent children who have no problems. The lighter shades represent children with mild problems in these domains, while that lighter shades represent children who have major problems. I think the first thing you can see is the vast majority of children, even children born extremely preterm, most of them have no problems on tests of reading, spelling, and maths. The other thing you'll notice that obviously they do have more problems when we compare them to a group of children born full term, but it's around 30%. It's about 30% for reading, 30% for spelling, and roughly 30% for maths. And the other thing you may notice is that when we look at the percentage of children who are having problems, the majority of them are having mild problems, or mild problems, as you can see, for reading, spelling, and maths. Now, I don't want to underplay the importance of mild problems for children and their families. They are important, but supporting and remediating these mild problems is generally easier than for children who have major problems. Many of you will be familiar with Naplan testing. This is government testing or educational assessments from children in grades 3, 5, 7, and 9. And what I'm presenting here are some results from a study which looked at Naplan at grade 3 for children in South Australia. They linked the Naplan scores for children in South Australia who sat in between 2008 and 2010 with their gestational age at birth. And this study was done with 28,000 children. So they grouped children according to gestational age, 40 weeks gestational age, 39 weeks gestational age, etc. And they also looked at children who were moderately preterm and very preterm. When looking at the Naplan scores, what they were interested in was children who scored in the lower two bands, band 1 or band 2, children who scored in Band 1 and Band 2 for these Naplan domains are performing at or below the national minimum standards. And at grade 3, Naplan assessed reading, writing, spelling, grammar, and numeracy. Now these figures probably, you don't need to understand this greatly, I'll take you through it, but this value of 1.34 is telling you that children born moderately preterm have a 34% increased risk of being in those lower bands for reading. And you can see that this is consistent for writing, spelling, grammar, and numeracy. So generally speaking, around 30%, they've got a 30% increased risk of performing in these lower bands on these different domains, Naplan domains. For very preterm children, it's higher. Very preterm children had a 57% increased risk of being in the lower lower bands than children born at 40 weeks. And that's increased for writing, spelling, and grammar, and roughly the same for numeracy. Now, I know there are many issues with Naplan testing, but studies such as this are useful because they're at a population level, and these results really do confirm the results that we see in more formal outcome studies such as the ones that we do. How many children need special educational needs? This is research from the United Kingdom. They surveyed 12,000 families or families of 12,000 children at 11 years of age. Parents were asked whether their child had been, they had been told by the school or any other agency that their child had special educational needs. They were also asked whether their child had a special educational needs statement. And as I understand it in the UK, this refers to problems of such a high intensity that they need provisions and resources. So again, they classify children according to gestational age. And for this purpose, we're just going to compare the children who were grouped at 40 weeks, who were born at 40 weeks gestational age, and compare them to children born very preterm. Children born at 40 weeks gestational age, 9% of those had a special educational needs according to the parent. While for very preterm children, it's approaching 27%, nearly 30%. 2% of children born at 40 weeks gestational age had multiple needs, while that was nearly 1 in 10 children born very preterm. And for those children who had quite significant problems that required provisions and support, there were 15% of children who were born very preterm who were in that position, in contrast to only 4% of children who were born at 40 weeks gestational age. So given all these findings, you may want to know how these children do educationally in the long term. Well, based on research to date, it's pretty clear that actually the vast majority of preterm children finish school, including those born extremely preterm. The data I've seen, the completion rates are only marginally lower than that for children born at term. Many of these children go on to tertiary education and go on to do other courses and formal qualifications. And in terms of employment, the employment rate is relatively high when you compare them to same age peers in that region that they live in. In order to help children experiencing educational difficulties, it is essential that the reasons underpinning those difficulties are identified. For children born very preterm and other children for that matter, educational difficulties could be related to sensory problems, such as seeing and hearing, cognitive or thinking problems, motor difficulty problems, as well as inattention, anxiety, and social and communication issues. It's important that we understand what the underlying causes are of their educational difficulties. And to do that, and while it's not always relevant, some children may need a cognitive or a neuropsychological assessment. This assessment not only can help to identify areas in which children are struggling, but can also highlight areas of strength. Understanding patterns of strengths and weaknesses will be helpful in determining the best approach for dealing with the issues of individual children. In a neuropsychological assessment, the psychologist will administer a range of different tasks and activities with the children, and these may examine attention, information processing, memory and learning, visual spatial skills, and executive function as well as language, which I haven't got up here. So there's a couple of other points that I really want you to be aware of. Different children, even if they're all born preterm, will present with different patterns of problems. No two children are the same, even if they have very similar medical histories. Also, the factors contributing to educational problems will vary from child to child. For example, for one child who has a reading difficulty, that might be related to an auditory or hearing difficulty. For another child, it may be related to working memory and information processing. And as such, the approach you take to helping these children would be quite different. It needs to be tailored to address their needs. Another consideration is that the educational problems that they have can emerge at any time, from early childhood, which is more common, through to late adolescence. And there's also the strong possibility that the nature of the problems that they're experiencing at school can change as the child matures and advances through school. So here are my take-home messages or points that I want to highlight. Learning and educational difficulties are more common in children born preterm, even those born very preterm and extremely preterm. However, many of these children have no problems or mild problems. The pattern of learning and educational problems exhibited by children born preterm varies from child to child. This makes it hard, impossible for us to recommend one general program for all children born preterm. Related to that is that there are numerous reasons why children are having learning and educational problems. Identifying these factors will help with the management of these children. Learning and educational difficulties are not necessarily developmental problems that children grow out of. Hopefully for many children that's the case, but for others the problems don't emerge until quite late in their schooling, when the workload increases dramatically and more abstract thinking and independence is required. And hopefully it's reassuring for parents and families that are here tonight that at the end of the educational journey, children born preterm generally finish high school, find employment, and are important contributors to the community. So that's a bit of background, and now we're going to hear some stories, experiences from firstly Julia.
Sure, thank you. So I am a mother of a 6.5-year-old son who's currently in prep. He was born at 30.4 weeks, weighing only 1.2 kilos. There were no unexpected complications during his stay in NICU, which was 6.5 weeks. But he did have some amniotic bands, which were identified at 20 weeks. So amniotic bands are where amniotic tissue wraps around the baby. It's apparently sticky tissue, and it does restrict blood flow, so it causes constriction. So that did require some treatment and monitoring in NICU, and I did have some specialist doctors come and have a look to discuss future surgery. My son met all his age-corrected developmental milestones. He was born in January rather than late March, so I enrolled him in 3-year-old kindergarten. And as a first-time mum, I just assumed that kids started school when they turned 3. However, at orientation, I soon realised that most of the kids there had already been 3 for some time and turning 4, and the developmental differences were readily apparent, not just to me, but also to other children. In fact, I remember one child saying to my son, "You know, what are you doing here? You're a baby." So it would be fair to say he didn't get much out of his first year of kindergarten. He really struggled to follow instructions and pretty much did his own thing. He didn't relate very much to the other children who were, starting to form meaningful relationships. My son did repeat 3-year-old kinder and certainly got much more out of it. Second time round, he was much more engaged and started forming some meaningful relationships, some of which he maintains today. But he did continue to struggle to follow instructions. He was very loud, struggled to concentrate, floated from one activity to the next without completing anything. I distinctly remember at Bush Kinder where the teachers got out witches' hats to indicate to the children the boundary that they weren't supposed to go past. And sure enough, it was my son that was often, running past the boundary and needing to be called back. And I also became sort of a parent of his developmental differences in comparison just to his cousins who are his age or even quite, significantly younger. My son just had difficulty sitting at the table for even a few minutes at a time for family dinners. And when we went riding scooters with his cousins, he was the only one that wouldn't stop at driveways, despite me, repeatedly calling out behind him to stop. He then went on to 4-year-old kinder, and in 4-year-old kinder, I decided to engage a paediatrician, which was very beneficial. The paediatrician did suggest that I look at getting an OT involved to see how my son would respond to some behavioural strategies, and that was one of the best things that I did. So with the OT support, we implemented the zones of regulation to help my son learn about feelings and how to regulate them. And also we did a social thinking program to develop his self-awareness. So he needed to be explicitly taught, for instance, how do you show someone that you're listening? So, your mouth is closed, your eyes are focused on the person, your body is still. And I remember going to kinder and we used to practice, walking into kinder, being calm, having calm feet and a calm voice. So it was all explicit teaching, which was very useful. And it was great to have a common social vocabulary that we could use at home and to prepare him with getting ready for school. Unfortunately, a lot of those strategies weren't implemented at kinder last year with COVID and staffing changes and for various other reasons. But I do remember halfway through last year, the kinder teacher pulled me aside and said, what are your plans for your son next year? And I said, I was quite sort of taken back. He was 5.5 at the time, doing very well in all areas except for attention, regulation, impulse control. He was starting to read and extremely social. She pulled me aside and thought that he would benefit from repeating another year of kinder. And I just pointed out to her that, he was 5.5, so that wasn't an option. And in fact, she had been looking at the incorrect birth date. But so nevertheless, there certainly were some concerns that were persisting and lingered around, but he did transition to school this year. Last year, I did speak to the assistant principal at the school to give him the heads up about my son's attention difficulties and his need for increased movement. He was lucky enough to have some sort of transitional program for school given COVID. It wasn't the full program, but it was something. And 3 weeks into school, I had a chat to his teacher who raised concerns about his concentration and attention, which wasn't surprising. But what I was surprised about is that she said that he had the potential to become the naughty kid because he was quite impulsive. And when I asked her about that, she said that, he had sat on her chair a few times when he'd been told not to. And there was probably more to it, which she didn't reveal. But I did get the OT to go in to do an observation. The teacher sort of wanted to leave it a little bit because it was early days. It was only in week 3. But I did get the OT in to do an observation, and during that observation, the OT witnessed my son having difficulty sitting still, and interestingly, he was one of the only few kids that couldn't touch the ground when he was seated at his chair, so he didn't have the postural control that a lot of the other kids did to help him sit still when he's sitting at the table. So that was one of the recommendations that she suggested, getting a foot rest just to give him a bit more postural control when he is at the table. So that was one benefit. And since then, I have regularly liaised with my son's teacher in regards to his difficulties with attention, impulse control. So we've had ongoing discussions. I have been trying to get some accommodations into the classroom. She's recently allowed him to start using a fidget toy as long as it doesn't distract others, which has been great. In terms of getting him to, have reduced time at the table because he does struggle to concentrate. I haven't really got anywhere with that, but it's a work in progress, as is movement breaks. But I guess part of what I'm hoping to achieve is helping her to understand the function of my son's behaviour, so why he is behaving the way he is, so that we can move towards putting preventative strategies in place rather than reactive strategies. So, yeah, that's my story today.
Great. Thank you very much, Julia. Thank you for coming here tonight and sharing that story. Your son sounds like a lot of fun, actually, but I'm sure he can be challenging in the classroom. So, Liam, could you share your screen now, please, and tell us your story?
Absolutely. Thanks, Peter. So we're probably a little bit newer to the process of investigating how we best engage with the education system for our daughter. So she was born just shy of 35 weeks, and we signed up for a study called preterm, which focused on investigating the development of children born in that moderate preterm phase. And she passed with flying colours, I guess you would say. So no concerns in terms of particularly literacy or numeracy. And we, I guess, first started becoming concerned at elements of her behaviour more based around emotional regulation, rapid escalation to very, very strong feelings, and then a seeming very slow process to de-escalate, really holding on to negative feelings and anger. And then just particularly in trying to get into a bit of a routine when we had our second child, just really struggling to maintain, remember, stick to the routine, and also just to finish tasks. We had a really experienced prep teacher, but nothing really came up in terms of classroom behaviour or any concerns. And we did ask explicitly whether there was any issues, and really didn't get any feedback that there was. And I guess for us, in the absence of not growing up in that family unit of 50 or 100 or 150 years ago, where you potentially observed smaller children in more detail as they grew up, we didn't really have a reference point. And so carried on. Then in grade 1, we had and 2 had quite inexperienced teachers, but and no real flags, except for at the start of last year, which was grade 2, the teacher did say that she had concerns about our daughter finishing tasks and just dragging her feet and sort of looking off into space and not being disruptive, not necessarily having any need to contain her physically, but just not getting the work out of her that she felt that she was capable of. So that was really, a light bulb moment for us, because we were finally getting a correlation between what we were seeing at home and what was happening at school. So we started heading down the path of getting some professional help externally. But it wasn't really until at the end of last year, mid last year, we started engaging in a bit more detail with the school. And I guess that's where there's, I think, a similarity with Julia's story, which is just engaging with the principal and with our daughter's teachers and just having that constant conversation. And I guess they responded really well to that. And she started spending some time with the school psychologist, some one-on-one sessions, and she also attended some of her classes and observed her in the playground and started working with her on some of those emotional regulation issues. And then she also did some testing and came up with some results that indicate that she does have some deficiencies in things like auditory processing, working memory, multitasking, those sorts of things. So some of the characteristics that would indicate inattentive ADHD. So we're sort of just at the start of that. That was only really a few months ago, of that process of continuing to work with the school on that. And again, much as Julia's doing, which is being in constant conversation with the classroom teacher and making sure that as much as we can, that relationship is one that is understanding of our daughter's needs. And then going a little bit deeper and speaking with the principal and looking at what the school is doing in a wider process, not just in the home classroom, but in the specialty subjects as well. And then obviously we'll have to do that again next year and ongoing, and then also look to try and give our daughter some skills to advocate for herself. So yeah, we've learnt that the school has been great, and has been really involved, but it's really as much as you put in and as much as you engage that seemingly really gets the results that you start to look for.
Thank you so much, Liam. It just goes to show how much advocating the parents need for children who are having problems at school. And you and Julia have described that really so well. We're fortunate to also have another story from Maggie Lloyd, who was going to be here tonight, but for health reasons can't be. But she was generous enough to share her story. She typed it up into a letter, and Abby is going to read that out for us.
Okay. So as Peter said, this was a letter that Maggie sent through to us. Hi there, everyone. My name's Maggie, and I'm mum to Jasmine, who is 20 years old and doing really well in her second year at university. Jasmine was born at 27 weeks gestation, weighing a tiny 633 grams. She had the usual prem-related issues, as well as a bleed in the brain, and subsequently developed hydrocephalus. Together with her prematurity, it was originally thought to have been a major contributing factor to Jasmine's significant developmental learning and mental health difficulties, which have been quite a big challenge to support and navigate throughout her life and schooling, and had always been labelled by her health professionals as just a prem thing. It wasn't until earlier this year that Jasmine received a formal diagnosis of inattentive ADHD due to a 6-year gap in formal assessments. I feel if she'd been diagnosed earlier, she may not have struggled as much developmentally, academically, or socially, and it could have meant extra support and guidance throughout high school and VCE. I know not all children born preterm will experience learning difficulties later in life, and this is our personal experience. But I hope that by sharing our story, I might help empower parents to advocate for their child if they think something isn't quite right with their child's development and learning. Trust your parent instincts, and if you don't feel heard by your current medical team, get a second opinion. To any teachers and educators watching, I hope I can help raise awareness in regards to schooling preterm children and what you can do to help support and advocate for these kids. Even if they don't yet have a formal diagnosis of a learning difficulty, they can still be struggling in a vast array of situations due to their early beginning in life and what may have followed. Our first big decision was to disclose or not to disclose to the teachers and educators that our child was born prematurely. Your goal as a parent is to work with your child's teacher to get the best education for your child, so it can be a big question for many prem parents. Have an open conversation with your child or teen about the pros and cons and what that might look like. I personally thought that the high school were better to teach and evaluate Jasmine without any preconceptions based on her birth history. However, I found that if I didn't disclose at the beginning of the year, I did end up needing to disclose towards the second semester. We didn't want a label put on our child in case that impacted negatively on what she was capable of. We didn't want the teacher or school to have lower expectations for her because she was born so early. We also didn't want her to use it as an excuse down the track to not always try her best. When we did disclose, we found working together as a team with teachers and the wellbeing team helped in part determine how Jasmine was understood and treated within the school, as well as the level of extra support that was offered as a result. As part of Jasmine's mental health difficulties, Jasmine has been seeing a variety of health professionals regularly. And luckily, in a way for us, this enabled her to receive special consideration from Year 7 until Year 10, where the school itself determines what support and special considerations they can provide based on the child's difficulties. With the start of VCE in Year 11, for Jasmine to continue to receive special consideration for exams, the school had to apply to the VCAA for special provisions and special examination arrangements on her behalf. Applications are reviewed on a case-by-case basis, so I can only tell you of our experience based on all the supporting documentation that we had for Jasmine. This application would include various teachers' letters of support, school reports, any assessments and supporting letters from her health professionals. If accepted by the VCAA, it would allow for special provisions to be made for Jasmine to meet the given subject requirements successfully. Things such as extra bathroom or snack breaks, extended exam time, as well as extensions on SACs and projects. This enabled Jasmine to successfully complete her VCE. However, if Jasmine had received her inattentive ADHD diagnosis prior to completing VCE, she could have been given the opportunity to complete her exams in a quiet room, away from distractions, which is something she herself would tell you would have benefited from immensely. When Jasmine was applying to universities, she accessed the SEAS program, Special Entry and Access Scheme through VTAC, the Victorian Tertiary Admissions Centre. This allowed an adjustment of her ATAR score in recognition of her circumstances that had affected her education. She was able to apply as part of the online application process and was accepted into her first preference at her chosen university. A CEAS application does not exempt you from meeting any of the course entry requirements of that uni. You must still complete the requirements listed under essential requirements and admission criteria. The minimum study score accepted might be reduced for the applicant. As part of this access, Jasmine receives special consideration throughout her degree if needed, and allows her to access extensions on coursework and one-on-one guidance for classes if needed. Hopefully hearing a little bit about our journey on navigating the school system with our ex-27-weeker helps empower parents who might be struggling, even if it's just a baseline of awareness in what might be available to access as far as support. Thank you so much, Maggie.
Yes, thank you, Maggie, and thank you, Abby, for doing that. So now we are moving into the Q&A session. So if I could ask the panel to please open up their videos so we can all see you. And there are a few questions that have come up which are directly related to some of the information I presented. So I might just deal with those first. One question relates to whether children who have difficulties in one domain often have difficulties in other domain, and that is true. I was going to show a slide, I took it out due to time, but I was going to show you some information which clearly demonstrates that children who do have difficulties in one domain often do have difficulties in others. Sometimes they have difficulties in 3 or 4 different domains. So that is correct, and that's information which is really important for trying to get the right services for children. There was also another question about moderate to late preterm infants, and I didn't focus a lot on those children. I apologise for that, and that was largely due to time and also due to the fact that most research is actually done in children born very preterm and extremely preterm. But we've heard from Liam today, whose daughter was born moderately preterm, that there are issues in some children born moderately to late preterm. Not as many. Those children are less likely to exhibit problems, but they are still at increased risk of having educational problems. And there's a lot of research to demonstrate that. But the prevalence is not as high. So, based on Maggie's story of her journey with Jasmine, she mentioned quite a bit about the issue of confiding with schools and teachers whether their child was born preterm and whether that helped or not. So there's a lot of discussion about that in the field. So I thought that we could start and get everyone involved in the webinar. We're going to send out a poll, and the poll's going to ask, how strongly do you agree with the statement, schools and teachers should be told if a child was born prematurely? So we're hoping all the audience will participate in the poll. If you feel comfortable with that, there's no right or wrong answer. We're actually going to come back to that question. We're not going to deal with that immediately. We're going to give you some time to think about that and respond to that. The first question I want to address has come from, well, the first bunch of questions have come from people who sent in questions when they registered. And there's some fairly broad questions to get things started. How do I know if my child needs support at school? So I might pass that over to Nicole to start off with.
Thanks, Peter. And I do think some of the parents who've already spoken have picked up on some of the things that I was thinking about in considering that question. But obviously, you know, those conversations with your teachers are really important. And I think some of the parents alluded to this notion of what I'm observing at home versus what are you observing at school? Because obviously parents would love to be a fly on the wall at school and see how their child operates in that environment. So definitely that relationship with the teacher is really important, and comparing notes, because we know that sometimes students do present very, very differently in a school environment to what they will at home. So certainly those relationships and building that relationship is important. And again, you know, you'll be looking at things like school reports, and even noticing things like how your child might present socially compared to their same aged peers at things like, you know, parties or excursions is another good way to kind of think about whether your child does need some extra support at school. And there's nothing to say that we wouldn't expect parents to advocate for their children. So 100%, if you are noticing something, or as Maggie said, you know, trusting your instinct, if there's an instinct in you somewhere that's telling you something's not right, and even if you can't articulate it or put your finger on it, it's really, really useful to have that conversation with the teacher who might be able to, I guess, enlighten you and either affirm what you're thinking or say, look, no, at this point in time, we're not seeing the same things. So that's kind of my thoughts on that at the moment.
Thanks, Nicole. Any other panel members want to add in on that? Gehan?
Thank you. Firstly, thank you, Julia, Liam, and also Maggie on behalf of Jasmine for sharing your stories, because I think if we synthesize all of the things that you talked about, we've got almost a perfect journey to try and describe that kind of advocacy pathway, which is often a lifetime journey for kids, where issues emerge as challenges change over time. So I think around that question of how to understand if they have trouble at school, it's often thinking back to even earlier than school. And as Nicole was saying, parents trusting their instincts and not being afraid to raise their voices up and ask for help. I think it's really important to build a care team around your child, and it might be, starting with obvious things like a family doctor and a maternal and child health nurse and your early education professionals, and starting the conversation early and checking in frequently so that you're not surprised by, something coming up, say in grade 3, where you had sort of a niggling suspicion earlier on, but thought maybe I'll just let it ride and see what happens over time.
What happens in a situation if the parent feels pretty strongly that their child needs support at school, but the teachers say, no, your child's doing okay, a little bit behind, doing okay? Chinsia and then Kate.
That's when you get an assessment done and you get a professional to come in and show them where your child's strengths and weaknesses are. So we often have parents say they've been trying for many years to suggest that their child has additional needs, and the teachers have said, it's very early, there's only grade 1, there's such a range of abilities at this time anyway, but they've persisted with it and got that assessment done. And that can be absolutely really powerful in terms of making schools kind of sit up and pay attention, particularly if you get recommendations around a learning intervention kind of program or learning support program. That then means that you need to have meetings regularly, that goals are set for your child, and that teachers really need to implement some of the strategies, because I think sometimes being an advocate all the time for your child can be really exhausting. I think we hear a lot of the time from parents. So I think if you're not getting the support you need early, then getting a professional in may actually be really helpful.
Kate, did you want to build on that?
Yeah, just to quickly reiterate a couple of things that people have said already and maybe add to it a bit. I would certainly encourage parents to listen to their gut. There is no one that knows your child better than you, even though there are a range of professionals who are trained and experienced in childhood development. Still, the parents and the primary caregivers are the absolute expert on their child. So certainly do follow your gut. Start those conversations with school. I would encourage parents to start those conversations with classroom teachers, but know that there are options to kind of move up within the school system first, and maybe asking about what are the kind of assessment services available through the school in terms of is there a special education team who can do some individualised testing themselves. A lot of schools now have their own screening practices that can be used to start those conversations around additional need, but then also give the parents some data that really does support that, getting that formalised comprehensive assessment. Sometimes those can be accessed through schools, and depending on the schools, the wait time varies. Often families do have to go privately for that. Unfortunately, the wait times now are quite extensive even, but generally better than within the education system. But it is time, it is money, and so it would be good to have some data potentially from the school that does indicate that, yes, your hunch is right, it would be worthwhile exploring this further. But ultimately, I hear over and over again from parents, during the mid-primary school years, the high school years, I wish I did this sooner, I wish I did this sooner. So really, don't hold off if you've got that thought.
Thank you. Liam.
Yeah, I was just going to say, depending on everyone's personal experience, I think sometimes I tend to think of, engaging with medical professionals on an urgency basis, and that, one of the things that we didn't do right away that I would have done sooner would have been just to go and see the GP, and to perhaps, I know personally it's changed my perception of what you go to see a GP for, and it's not just when you're sick, or it's not just when there's something concrete. You can really use them as your health pivot, and they can then direct you to the professional that you need. And maybe everyone else knows that, but it certainly wasn't a concept that I was necessarily at home with. And then I think as well, when engaging with the school, and particularly with the teachers, if you ask a question like, are you seeing any differences, or are there any concerns that you have? I think, first of all, it's a pretty closed question, and in our parent-teacher chats, they're pretty short, and so it's possible. And as Chincy was saying, there's lots of variability in abilities in that prep and one space, so it's very easy for a teacher to say, oh no, like I think it's fine. And I think also, if you think of your own workspace, that sometimes it's easier just to scratch the surface on some of these issues, and the deeper you go, kind of it becomes more work or more engaging. So I think human nature will be that potentially a teacher might not want to upset a parent, or they might not want to engage too deeply in the process. But I think if you asked a question differently and said, look, the reason why I'm asking is because it's affecting us at home, and it's we'd like to be arguing less, we'd like to be upset less. We're looking to create a bit more happiness in the family, and it's our concerns are based around these activities. And if you just, I think, build a bit more of a story, then I think potentially you're more likely to get a little bit more detailed information, or potentially that teacher can then go and start observing with that frame of reference. But I think if you just come to them and say, look, is my child different to everyone else? My gut feel is that they're not that likely to jump into that, into that potential, danger area.
Yeah, great insights. Thank you very much. This is related, and I already know the answer to this question based on everyone's comments already, but I think it's worth just addressing this specific question, and I'll ask Gihan. Knowing my child has developmental issues, should I start early with getting support, or wait and see?
Yeah, thanks, Peter. So absolutely starting early. There's a whole body of research around the importance of early intervention. And the earlier you start, the more opportunities you give your child in terms of being able to reach their best possible outcomes. Children obviously keep growing and learning and developing throughout childhood and into early adulthood, but there's absolutely no reason to wait around if you're noticing things and your primary care professionals are on board. Liam, you mentioned the GP, the maternal and child health nurse, who are often seeing kids frequently and doing developmental screening. I would definitely work on getting those community professionals on board and using that as a starting point to get appropriate referrals. Julia, you mentioned getting an OT involved, really helpful, and there's lots of support pathways to access early intervention, which we can talk about time permitting.
Thank you. Abby, have we got the results from the poll? While we're waiting on the results from the poll, I'm going to ask the panel what their opinion is about whether families should tell schools and teachers whether a child was born prematurely. Here's the results. Hopefully everyone can see it. I can see it. Says 41% strongly agree with the statement that schools and teachers should be notified. 46% agree, and 13% are neutral. So the panel, you might have a different opinion or not. Kate.
I don't have a different opinion. I'm of a similar opinion. I think kind of knowledge is power, and the greater communication and shared understanding about a child, the better. And I think that does give the teacher a more of a reason to keep a closer eye on things that this child is at, and explaining, you know, to the teacher what that means. To be born extremely premature does not, you know, guarantee these certain outcomes, but it does place a child at greater risk, as do other, you know, medical conditions and family history conditions. So yeah, I do think having that conversation and explaining why you want to keep a close eye on your child's development, and that it would be helpful to have the insight and opinion of the teacher is going to more likely produce the better outcomes and get that information shared sooner rather than later.
Building on that then, and I'll ask this to Nicole, given she's probably best positioned to answer this question. Nicole, do teachers and schools know much about the potential issues faced by children born early?
Yeah, that's a great question, and picked up on something that Kate was saying there too. It's really important that as a parent, if you are disclosing that information, you do explain what that means for your child, because I think, Peter, you explained earlier that, you know, everyone's different and they do present differently at different points in time. So if you are disclosing that to the teacher, it is important to say, what does that mean for your child? What do you know about it? I mean, it's highly likely that you've looked into the research around this a lot more than your teacher has. There are so many things for teachers to know, and so many disorders and disabilities. It would be very difficult for them to know exactly what that means for your child, other than to combine that with the information you provide and their own observations and data collections. So yeah, certainly picking up on what Kate was saying there, particularly around explaining how that relates to your child. But no, teacher, you can't assume that just because you've told the teacher a diagnosis or that your child is preterm or anything really, that they will know what that means for your child, because it is quite individual.
Yes, go ahead.
And yeah, agree with all of that. And I think just important to add to that, when you're talking to the teacher about you know, your child's prematurity, to go in armed with the information to say this is not to necessarily set them apart or set them on a different trajectory or to change or lower expectations, because the research says most kids who are born very preterm, they do really well. But what we want the teacher to get engaged with is the fact that they're at higher risk of various learning, attention, emotional concerns compared with a kid who wasn't born preterm or who was born at full term. So I think it's finding that balance of working towards and expecting success, but also making sure the teachers are kind of tuned into looking for early indicators that might necessitate further assessments and interventions.
Thank you. Yes, Chintzia.
Sorry, I just want to add too, and Julia, I think your comment really struck me about the teacher saying, you know, that your child was at risk of being the naughty child. And I think sometimes sharing the information with them about your child's medical history can avoid some of those labels being misattributed to their behaviour. So understanding that they are having difficulty with their emotion regulation or inhibition or other things because of their prematurity rather than a personality trait or something else, can actually be really powerful and helpful to make sure that they remain engaged, you know, and teachers keep trying to engage them in the learning process rather than labelling them as the naughty or the difficult child in the classroom.
Okay, thank you. Now I'm going to have a couple of questions that are focused on the type of supports a family can get or can expect. The first question is, if my child needs support, what is a reasonable expectation from the school, and what are the expectations of the parents? Anyone want to have a go at that, or do I? So, yeah, so Nicole first and then Kate. Thank you for putting up your hands.
And look, my thoughts feed into something we discussed earlier around should I disclose or not disclose. At the end of the day, it is the parent's right to to not disclose that information. We, I guess we all advocate for sharing of information, but it's still really the parent's right. And I think I wanted to assure people that teachers are professionals as well. They do make really astute observations, and they have that really great insight because they're able to compare large cohorts of students at the same age. So we do need to trust some of our teachers as well. But Peter, can I just get you to repeat the question because it's just going in my head for a moment?
Yeah. If my child needs support, what is a reasonable expectation from the school, and what are the expectations of the parents?
Yeah, so in terms of reasonable expectations from the school, I think that's an important question. It's actually one I get asked a fair bit from parents. And it goes back to that relationship building and that team around that learner. So you as a parent are part of that team around the learner, as is the teacher. So, your expectations are things like, are you making some reasonable adjustments for my child in the classroom? Have you got their attention before you're speaking to them? Can you place them closer to the front? Can you go and do a check-in with them after you've given the whole class the instruction? So all of those kind of reasonable things and that test of reasonableness within a classroom of up to, 28 or 30 kids sometimes. And also, one of the things I found useful is having a communication plan with the school. So what you might think is reasonable, you might think it is reasonable to speak to the teacher every Friday afternoon, and that might not be something that the teacher can manage. So at the outset, when you are meeting with the school, talk about, what could be a reasonable expectation around how often we could meet and talk informally versus formally. In terms of formally, we do normally recommend that schools meet with families at least once a term if there are, significant adjustments being made for that student in the classroom. And also as a parent, be really strong in advocating for minutes to come out of those meetings, just so that everyone's kept accountable, kept on track, and we can kind of see where things are headed as well. In terms of parents and expectations from their part, I think schools would probably say, be open and honest and sharing. And that's not always easy for parents. They might not be at that point in their journey where they're ready to share. So schools know that they have to be patient sometimes. But I think that's what schools would expect, is that A, parents advocate for their child, and B, that they're open and willing for that relationship and that communication to occur. I think Kate also had her hand up. She wanted to add to that.
I was just going to say, in terms of kind of what can parents expect in terms of the support that schools can provide. I would say at the very base level, it's important to understand that teachers and the education system are expected to differentiate for students within the general classroom. Students do not require a specific diagnosis for that to happen, and this is something that does happen day to day in all different subjects and in lots of different ways. And these are very simple things like repeating instructions, going and helping a child get started on a task, breaking down a task into smaller discrete steps and giving one step at a time, modifying the work by maybe in the younger years, some children may be tracing a sentence, whereas other children are independently generating a sentence, in writing. So those kind of things happen, every day in the classroom. And certainly when I talk with teachers, when I do an assessment of a child, I usually do speak with teachers, and teachers more often than not can very quickly kind of list off what are the adjustments that they have been doing for the child. So that's certainly, like Nicole mentioned, to have a formal discussion around that could be very helpful, and that does usually happen through what's called a student support group meeting, where you have the parents, you have the teacher, and there's often maybe a learning support officer or an assistant principal sometimes plays an important role in those meetings, and sometimes you can have those external professionals as well, such as the occupational therapist or the psychologist, and so that those regular meetings just do help to make it very clear what are the adjustments, how is the child responding to those adjustments, what are their changing learning needs over time, and how are we going to continue to keep up with those. Just to say one more point in beyond the standard kind of differentiated instruction practices within the classroom, schools do vary greatly in terms of then the kind of small group withdrawal or individual support. So again, having those conversations with schools around how they do provide that more intenser and smaller group support for students is helpful to have those conversations and those understandings.
Thank you. So, sorry, Guillen, I might have to move on. We've been focusing on the school, but what about what the parents can do at home, and what supports can families get outside of the school? Anyone want to chat? Give that a go. Chinsia, do you want to have it? Guillen put his hand up first.
Yeah, I'll hand over very quickly to Chinsia, but I think that's such a broad question, and it begins with working with people who can help you to understand really a profile of your strengths, of your child's strengths and needs. And that's where the early intervention question comes in, or the early intervention argument comes in, where the earlier you can try and understand the areas where your child needs support, the quicker you can start focusing, whether it's around speech and language and communication development, or motor skills, or emotional regulation. It's really important to try and figure out what's the area that's causing the block to your child being the best they can be, and then try and figure out which professional you bring on board to try and help them through that.
Thank you. Anyone else want to add? Chinsia?
I will add to that. I think that, Guillen's very right in terms of saying that, it's about identifying what difficulties your child's having, but really the strategies that we suggest for teachers are often the same for parents. So repeating yourself, slowing things down, breaking tasks up into one step at a time, doing those kinds of things. And it's around, I think, again, responding to your child, seeing what strategies work, because it's not one size fits all. All children are very different. Sometimes a strategy we might suggest for inattention doesn't work because the child's having reading difficulty. So writing, the instructions down is not the strategy. So I think it is great to get a kind of a broad brushstroke of where they're having the most difficulty. And then there's occupational therapists or speech therapists or early intervention specialists. There's a whole range of people who can really support that. And as Liam noted before, having a family GP or paediatrician as kind of your central point to identify who the most appropriate people to engage are is, from my experience with families, is how leads to the best success.
Building on that, we've got a direct question from a family. How can we organise a cognitive or neuropsych assessment? Can you please recommend someone? Maybe we'll do that offline, actually, but there are plenty of services available, quite hard to get into given waiting lists, but there are both Kate and Chinsia can recommend a long list of people in your area. So maybe if that person can send us a message as to where they're from, and that can help us give you some, we can recommend some names. But just generally speaking, Chinsia and Kate, just on, at a general level, how do they go about finding someone to do a cognitive or neuropsych assessment?
So I think, sorry, Kate, did you want to go for, I think you mentioned this before, Kate, the best place to start is with the school and really to go to them and say what's available. Cognitive assessments can be very prohibitive in cost. So if the school's able to engage a psychologist, if they have their own psychologist, or they can get a psychologist who can come in and do an educational assessment, then that's often, the best place to start. Otherwise, there are many private providers. Unfortunately, due to COVID and lots of kids now struggling, wait lists are at around 6 to 12 months to go and get an assessment. But those assessments do usually start at about $2,000. So they can be very pricey depending on where where you go and what kind of assessment you need for your child. But I would always start with the school first, or if you have experience with a speech pathologist or an occupational therapist first, then to ask them where they think might be best in your local area.
Yeah, just to add to that, I think first inquiring with the school as to what assessments or what parts of a comprehensive assessment they might be able to do as a way to possibly keep the cost down. But then also the schools generally do have a range of recommendations of local providers that they have received many reports from in the past, that they have worked with in the past, and then you would expect have found their assessments and the reports and the recommendations helpful. So that could certainly be a good starting point. Other parents as well, talk to other parents about where they went and what they found helpful. There are private practices. There are many private practices, and it does cost time and money. I guess the thing with these comprehensive psychoeducational assessments or neuropsychological assessments that do take a very broad and comprehensive look at the individual. So look at their cognitive ability, their language, their attention, their social, emotional, behavioural functioning, to identify those areas of strength and challenge. These kind of assessments don't, you need quite a degree of gap between doing it once and doing it again. So it is time and money, but it's not something that you would be doing every year or every couple of years, or even necessarily every 3 or 4 years. It can be something that happens once to twice during primary school, and maybe again once to twice during high school. So it can be worth the money. The other thing I would say as well is there are university clinics where master's students do these assessments at a reduced cost. So there's Monash University, there's Swinburne University, there's Melbourne University, but I believe their wait times are greater than private practices at these times, but because of the impact of COVID. So again, if you're just kind of having a little inkling, maybe it's time just to kind of start inquiring, and maybe get yourself down on a wait list somewhere while you're still gathering more data and information from the school.
Okay, quickly running out of time, but we've got I'm going to try and get through as many questions as we can, panel. Okay, so I'm going to direct questions towards you now. I think one question, the person wants to know what role genetics plays and whether genetics plays a part at all in the outcomes for children born prematurely. I might pass that to Gihan.
Thanks, Peter. Yeah, absolutely. So the family, the genetics, so what you inherit from your mum and your dad, obviously sort of set the scene for future success. But what we do know is that the effect of prematurity can be sort of an additive effect on over and above the genetics. So, that can be either a buffering type effect. So you might be more at risk because you're premature, but that might be buffered because of the skills that you gain from your parents. Or it could be an additive effect where if a parent, for example, has their own learning difficulties, the effect of prematurity might be additive on top of that and confer increased risk. So it's definitely not either or, but it's one, genetics, and then working through the biological risk or the risk conferred by prematurity as well.
Thank you. What are the types of interventions for attentional and concentration problems? Kate?
So there are a number of different ways we can support students with attention and concentration problems. One of the main ones is to modify the environment around the child, so to make adjustments within the classroom and at home in order to reduce distractibility, keep them closer for easier cueing and prompting by the adult. Diet and exercise have also been found to play a helpful role. There is cognitive behavioural therapy as well that can help students develop a greater insight into their emotions and how that influences their behaviour and the ability to exert choices and control. And then there is also the option of medication, stimulant medication for attention difficulties, which Gihan would be able to speak more to.
Thanks, Kate. Yeah, absolutely. And completely agree with everything you said about kind of modifying and optimizing the environment. Spend a lot of time talking to kids about exercise, outdoor exercise and healthy eating, and especially sleep, especially as they hit the late primary and teenage years. It's a constant battle managing screens and having good sleep hygiene, getting plenty of sleep. But I think if all of those things are being taken into account and there's still attention problems that are causing functional difficulties, then it's time to talk to your paediatrician about a trial of medication. And I think when I speak to young people about this, it's always framed in terms of a trial. You know, let's go into this with our eyes open. Let's have some clear goals for whether this medicine is helping you or not. And let's get everyone involved, the parents, the teachers, the child, in terms of giving feedback. Firstly, is the medicine safe, so it's not causing side effects? And secondly, is it effective? Is it helping us to reach our goals of improving concentration and self-regulation and impulse control? So it's a complex conversation, and not one that you would, definitely not one that you'd get done in one visit. It's kind of a series of conversations and trying to figure out the right pathway.
Thank you. We've got a question about the different education systems. This person's wondering if public versus private school impacts on the child's outcome. Our public school just doesn't seem resourced to help our child. Cinzia?
It's a very difficult question. There are some public schools that go beyond and above and are fantastic. There are some private schools that have lots and lots of extra resources but may not just fit your child. So I think it's probably not as clear cut as private or public. It's more around what your child's needs are and the school environment that will really best suit them, and also the kind of social school environment that may best suit them as well. So I often say to parents, you need to do a bit of hunting around, you know, visit the local schools in your area, speak to the wellbeing officers and the principal, and get a real sense of you know, share your child's story with them up front and see what they're able to provide. And I often think it's the teachers themselves, really. I mean, my husband's a teacher, and I always say, you know, one good teacher can make the world of difference. So I think really going to the teachers and, you know, helping them understand they have all the skills necessary to teach your child, that just because they were born preterm doesn't mean that they have different types of difficulties to a whole range of children who are born at normal at term, who may have working memory difficulties or attention difficulties. So they're trained in the strategies that help those children, and that they will help your child just in the same way as other children who are born without any medical history. So I think it is really about individual schools. All schools have extra resources that they can use and implement, but again, finding the right fit for your child can be really challenging. But I think, yeah, again, that private-public divide is a black hole, really.
Yeah. Nicole, you might want to have something to say about that, but I'm not going to give you an opportunity because I'm going to ask you the next question. Once you have a diagnosis, in this case, dyslexia and dyscalculia, how do you choose which program specialist to engage your child, especially when these are not considered disabilities and so you do not receive funding?
Yeah, that's a good point. It is true that in terms of the Victorian state school system, we don't have children with those diagnoses attracting supplementary funding. However, as Cinzia has said, schools do have resources that they can access, and I certainly know within Victorian government school system, teachers are accessing professional learning in this space. There are actually operational guidelines around that. And we've also got teams of student support services who are teams of education psychologists, speech pathologists, sometimes social workers and occasionally occupational therapists as well, who can advise schools and teachers around the particular profile that that student's presenting with, and make recommendations around particular programs that are evidence-based that would work well with that child. And on the flip side of that, I guess, as parents, you can definitely ask schools, you know, when you are approaching schools and thinking about, is this school going to work for my child? And if you already know about some of those diagnoses, then you can definitely ask them those specific questions. Things like, you know, what experience does your school have with students who have dyslexia or dyscalculia? What have you found worked with them? What sort of small group work could you run, or would you explore for students with those kinds of diagnoses? So again, it's about that. It's about that communication, and I think Liam alluded to this as well, asking those specific questions. Don't be scared to drill down on people and ask them, you know, point blank what you need to know, because you're the one that knows your child really well.
Thank you. We are going to have to cease the Q&A session there. We do have additional questions. Some of the questions overlap with some of the other questions, so hopefully we've at least partly answered some of the questions we haven't got to tonight. Some of them are very individualised, and we will try and respond to you after the session. I just want to highlight again that this Listen, Share, Learn webinar has been hosted by the CRE in Newborn Medicine. And here are the people in the CRE. You can see it's a very large team of clinicians, researchers and students from across different health disciplines. And this webinar series is just one of the initiatives of the CRE to bring families, service providers and health professionals together with the aim of working together to improve outcomes for babies born preterm, or those babies who are unwell at birth, as well as their families. We encourage you to continue this discussion about navigating the education system for children born preterm with your family, friends, healthcare professionals and service providers in the school community, as well as getting involved with organisations and centres such as the CRE in Newborn Medicine. If you're interested in connecting up with us, please do so. Here are some details. You can see that what everyone's saying is to be open, have open discussion with the teachers in the school, and really advocate hard for your child. So if tonight's discussion has raised any issues for you, please reach out for your support networks, your GP, or the support organisations here. I want to give a very special thanks to the panel, but particularly Julia, Liam and Maggie for sharing their stories. And thank you again to Gihan, Shinsia, Kate and Nicole, who have very generously shared their time and their expertise. And I think you'll agree that we've been able to put together a fantastic panel. These webinars take considerable organisation, months of in planning, and a lot of effort on the night. And it's only been possible due to Abby Eels, who you saw before, as well as Renee Allen, who's there in the background. And there's no way this would have been possible without their amazing contribution to. So thank you to both Abby and Renee. And finally, thank you for your participation and questions, and for those watching this at a later time. We hope the session has been informative and valuable. So goodbye, take care, and stay healthy.